I think that's why I'm appreciative of this conversation, because with that barrier being put in place so that people are not able to communicate, we are still able to break down those barriers and transcend so that the message can go out there. And I'm hoping that a lot more people will actually go to start researching after watching this, to try understand what exactly is happening, because information is being kept inside so that it doesn't go out. But I want to segue into health sector. People are affected, hospitals are shut down and all of that. What are your experiences in that area?
So I'm a medical doctor myself,
Yeah.
and I've been aware that the healthcare sector in Sudan has been a bit fragile, like even before the war. So it has been neglected. There isn't that much investment in health. And most of the healthcare sector, especially the specialized, operations and processes, has been privatized generally in the country. So there is a public sector in that sense, and there is a private sector. But when the war started, the private sector is a for-profit sector. So in that sense, whoever was running those hospitals just left the country. And we're talking about people who are well-established, specialists or consultants, and those people can easily get jobs somewhere else. So in that sense, we had a lot of manpower migration. And also because of the unsafe nature of the country, a lot of the people were actually forced to flee their houses, and that included, healthcare staff. So we're talking about 30% of the entire population had to move somewhere, either displaced internally or had to cross borders somewhere else. So that's like 14 million people. And those people were depending on, let's say, on jobs.
Yeah.
So if you're not able to get paid, how would you sustain your family? And if you cannot put food on the table, so what we have to do is that you'll try to find an alternative option, and then you leave. And there isn't like healthcare tool supply. Electricity has been shut in parts in Khartoum, which is the capital city, since April 2022. Sorry, April 2023, which is like a year and a half now.
Yeah.
More than a year and a half, basically. So there has been areas without electricity since that day. And I have personal experiences with that, because I had two uncles who passed away during this war. And both of them because they were not able to access, proper healthcare. And in that access, not only like healthcare has not been provided or healthcare services are not provided, but also being able to physically get to a hospital. Because as you know, if you're in an area where the other, let's say, army or armed force is taking control of, you have to get a permission to get to that hospital. And the kind of like the situation in the country that no one knows about is that when the armed conflict started, when people had to flee their houses, so what happened is that those armed forces were actually getting into houses. So they actually break into houses, and they've stolen, first of all, like, jewelry and money. And then afterwards, they started, like stealing furniture, electricity, like all the electricity supplies and like wires and then devices and all of that. But most importantly, they stole cars. So they were like, they take your car. So I'll break into your house and I'll put a gun to your head, and then you give me your keys. And then you'd give them your keys. So no one had a means of transportation to get to a hospital. And the majority of the citizens, especially those who are still in affected areas, were not able to get to hospital. That was the case for both of my uncles, basically. They were not able to get to a hospital. So not only the healthcare sector is affected, but also, your transportation means, inability to, even if you wish to leave the city, sometimes you are unable to. So, and in that sense, a lot of diseases has been spread. So there has been an outbreak of cholera, and there has been other outbreaks as well of other diseases. So people are affected in that sense, and they're unable to get healthcare services. And as a result of that, we've have so many reports of people losing their lives.
As I'm listening to you as you speak, it sounds like you are literally narrating something from a movie. It doesn't feel like in the modern day, we have people that are subjected to such. I understand that you also have meetings that you need to rush to, but I'm really hoping that depending on the reception also of this episode, that we can come back and actually get into detail with the nitty-gritties, because this is not something we can capture in just few minutes that we have. This is something that needs an elaborate sit down and have a conversation and drill down into some of the things so that whether people like it or not, we keep hammering the message into their heads. And hopefully that one or two people, even if it means just taking a placard and going into the streets and protesting so that they bring awareness to this issue. Because whenever these type of conflicts happen anywhere else in the world, there is urgency, But when it's conflicts that affect people of color, it's like the lives of people of color don't matter, So they're just left to be there on their own, There's no intervention whatsoever. And at present, there's all these foreign countries, entities that are now being involved, supplying different sides and all of that. But I think we'll get into that in much more detail a bit later on. But as we head towards concluding this episode,